Hi everyone, my name is Marina and I am a clinical herbalist and the author of the Demodex solution. I'm not a medical doctor, but we've helped thousands understand these pesky parasites. My goal is to provide you with a research-backed look into Demodex mites so you can take control of your skin health. Demodex are microscopic mites. They're about 0.15 to 0.4 millimeters long that live in our hair follicle and oil glands. There are two species, Demodex folliculorum and Demodex brevis. Everyone has a few of them. In fact, studies show almost all adults host these mites on our skin. They usually coexist with us harmlessly and even help eat dead skin cells. So problems only arise when they overmultiply and trigger inflammation. So these might have a short life cycle. They come out at night usually. It's about a 2-week life cycle. But all of this happens invisibly and can wreak havoc if their numbers explode. So the first sign that you do have a problem, a Demodex mite problem, is persistent itching, especially at night. Do you find that your face or scalp gets unbearably itchy in the evening or early morning hours? Demodex mites could be to blame. Here is why. Demodex mites are nocturnal. They avoid light and become mostly active in the dark, coming out of your follicles to feed and mate while you sleep. Dermatology research notes that Demodex-related itch often flares up at night or early morning after they have been active, which is a key clue distinguishing it from daytime allergies. So if you notice your skin problems come alive at night, that's a red flag for Demodex. You may be feeling a prickling sensation, tingling sensation, or just relentless itch on your face or scalp, or even inside of your ear canals. So they can even inhabit ear follicles as well. Many people report lying in bed feeling like something is crawling on their skin. Because they're microscopic, you won't see them with the naked eye, but the timing of symptoms is truly telling. So for example, one study in an ophthalmology journal pointed out that patients with Demodex infestations tend to experience their worst itching and discomfort in the early morning, so after the mite's nighttime activities. Contrast this with typical eczema or allergy itching, which can occur anytime. If your itching reliably gets worse at night, consider Demodex. A WebMD article confirms that these mites literally come out at night to feast on your skin cells, then hide back in your pores all day. Pretty creepy, right? But it explains a lot. Your skin might be reacting to the microscopic chaos happening while you sleep. So what to really look out for is itchiness that peaks at night, face, scalp, or even eyelashes, sometimes accompanied by slight tickling or crawling feeling. You may also notice that anti-itch creams like hydrocortisone give only temporary relief. Dermatologists have observed that these infestations often don't respond to steroid creams, and itching keeps coming back. So if you're scratching at 2 a.m. and nothing seems to help, the mites might be the hidden cause. The second sign that you may have a Demodex problem is having chronic redness, rosacea, or acne-like breakouts that don't respond to typical treatments. Demodex overgrowth can really manifest as persistent skin inflammation that mimics acne or rosacea. But there is a twist to it. It often resists the usual therapies. If you've been diligently treating what looks like acne or rosacea with little improvement, a Demodex infestation can be underlying it. Rosacea is a skin condition causing facial redness, flushing, and sometimes pimple-like bumps. Researchers have found a striking link with these mites. People with rosacea often have dramatically higher Demodex counts on their skin, and one study found up to 4 times more Demodex mites on the face of rosacea patients compared to those without rosacea. There is a thing called ocular rosacea as well that affects the eye. It has been associated with Demodex in the eyelash follicles and even tear ducts. It's a bit of a chicken and egg scenario. Does rosacea allow Demodex mites to overpopulate, or do the mites trigger the reaction? Current thinking suggests it's a vicious cycle. Excess mites can provoke inflammation. For instance, bacteria inside Demodex mites, which is called Bacillus oleronius, when the mite dies. For instance, this can spur the rosacea flare-up. But on the flip side, the redness and oiliness of rosacea might cause a better environment for mites. So for either way, if you have rosacea that isn't improving with standard treatments, consider that Demodex might keeping the fire burning. So now we can move on to acne-like breakouts. Demodex can cause a type of folliculitis that looks just like pimples or whiteheads. You might see small bumps, pustules, or whiteheads that really linger, especially around the nose or cheeks or even near the eyes. One telltale clue is sudden onset. So signs of demodicosis can come on very quickly, even overnight, with a crop of tiny whiteheads that resemble acne popping up around your eyes or your nose. If you literally wake up with unexplained breakouts, Demodex is suspect, since we learned they reproduce and cause reactions overnight. Another clue is resistance to usual acne medications. So for example, if benzoyl peroxide, salicylic acid, or prescription creams aren't clearing these pimples, it may be because you're not dealing with a typical bacterial acne at all. You're dealing with mites. So dermatology case studies of demodicosis specifically in acne patients show symptoms like redness, dryness, scaliness, itching, burning, and bumps that just don't resolve with normal acne treatment. This was found in dovepress.com, which was another great resource. The name was a case series of demodicosis in acne vulgaris patients. So it was a case study. These are exactly the case where an anti-mite therapy like ivermectin or sulfur finally made a difference. What to look out for? Persistent redness across your cheeks and nose, which is rosacea, with sensitivity or acne-like breakouts that don't behave like regular acne. So does your skin stay red, inflamed, and papery thin or sensitive despite gentle care? Demodex may be triggering that rosacea-like sensitivity. For instance, you've tried all of the acne products and even antibiotics, but they haven't really done much. That could be Demodex folliculitis. A classic sign is when patients finally try a mite-killing treatment, like a tea tree oil face wash or prescription ivermectin creams, and their acne dramatically improves. In fact, the success of these treatments is part of what clued doctors into Demodex's role. Health experts now advise that rosacea patients with poor response to standard therapy really get evaluated for these mites. So if you have rosacea or adult acne that just doesn't quit, consider asking your dermatologist perhaps about Demodex or researching it online. So the third sign that you may have a Demodex problem is rough, dry, or sandpaper-like skin. That's often described as feeling like sandpaper, right? Not all Demodex infestations look like obvious pimples or redness. In some cases, the clue is in the texture of the skin. Do you have patches of skin that are rough, slightly bumpy, or flaky no matter how you moisturize? This could be Demodex mites trying to clog up your follicles with debris. There's even a name for this Demodex-induced skin condition. It's called psoriasis, sometimes called Demodex follicular dermatitis. It tends to occur in middle-aged or older adults and often gets mistaken for simple dry skin or seborrheic dermatitis. What it looks or feels is a mild redness with a diffuse sandpaper-like feeling across the skin. Usually this happens on the cheeks, forehead, or chin. If you run your fingers over the area, it is not smooth. You'll feel a fine grainy texture. The follicles scaling, basically tiny scales and plugs at the openings of your hair follicles caused by masses of Demodex mites and their waste. So another source called DMA&x, a trusted dermatology resource, describes it as a spinulate prickly demodicosis, where the skin has a digitate keratosis, finger-like roughness. Picture many little clogged pores giving a gritty feel. Patients with this Demodex-related rough skin often report tightness, dryness, and mild itching or burning in the affected areas. It's as if the skin's surface can't really exfoliate properly, leading to a buildup of dead skin. It's because the mites are interfering with the normal oil balance and skin cell turnover. The sandpaper patch may have a bit of a dull, reddish hue or to be slightly pink. Crucially, normal moisturizers or even steroid creams don't fix it long term, because of the underlying problem, which is the mite overpopulation, remains. That's why it can't be fixed long term. The skin might temporarily feel better with a rich cream at night, but by the next day, that roughness is back. Dermatologists have noted that Demodex infestations can cause diffuse folliculitis, which means inflammation of the hair follicle, without major pimples, just rough, bumpy skin and some redness. The Cleveland Clinic also lists rough feeling on your skin like sandpaper as a symptom of Demodex overgrowth. So if you notice a persistent rough patch or generally rough skin on the face, especially if you're past puberty, if it's not an issue for you, Demodex is worth considering. The sign is often very much overlooked because it's not dramatic. It's a subtle chronic roughness, but it can really affect your complexion. So what can we look out for is fine white dust or scales on your face and a gritty texture when you rub your skin. Also, check if there's any faint redness or enlarged pores along with roughness. Demodex-related rough skin can accompany redness, like mild rosacea, or even exist on its own. Importantly, if you have this and also experience night itch or resistant acne that we spoke about, further points to Demodex. Dermatology literature states that Demodex folliculorum infestation presents with slight redness and a sandpaper-like texture of the skin due to follicular scale, which sums it up. The good news about this is once Demodex is treated with a topical treatment, the sandpaper skin often softens up dramatically. The fourth sign of a Demodex problem is a chronic eye irritation or eyelid inflammation, which is blepharitis, or strange issues with your eyelashes like crust, dandruff, or even lash loss. That's why we see a lot of eyelash wipes being sold on the market today. Demodex mites don't just live on facial skin, they love to infest our eyelids too, especially Demodex folliculorum, which clusters in the eyelash follicles. If you wake up with red itchy eyes or have persistently inflamed eyelid margins, Demodex could be the culprit. One classic giveaway is something called cylindrical dandruff, a wavy cylindrical crust that forms at the base of your eyelashes. Each follicle can harbor multiple mites. So Demodex in the eyelids causes a condition known as Demodex blepharitis, simply means eyelid inflammation. Demodex are a very common cause in this. And in fact, studies suggest that 70% of chronic blepharitis cases involve Demodex mites from nature.com. How do you know it's Demodex and not just regular dry eye or allergies? The telltale sign is its debris. So the debris on the eyelashes. Eye doctors are trained to look for collarets or cylindrical dandruff at the root of the lashes. This is essentially a sleeve of waxy waste and skin cells that Demodex mites create. It looks like a little sleeve or a collar encircling the base of the eyelash. And if you have it, it's basically considered proof of the infestation of Demodex on the eyelids. So just check your eyelashes and see if you have any crusty or fibrous looking debris at the base of it. Furthermore, Demodex can cause your eyelashes to fall out or grow abnormally. In more severe infestations, you may notice thinning of your eyelashes, which is called madarosis, or some lashes pointing in odd directions because the mites distort the follicle. The Cleveland Clinic notes that Demodex eye infestations can lead to loss of lashes and thickened or scaly eyelids. If you've been diagnosed with blepharitis but it never fully goes away with regular eyelid scrubs, antibiotic ointment, Demodex is a prime suspect. The fifth reason or problem that you may have Demodex is itchy scalp problems or even hair thinning that can be explained by the usual causes. We focused on face and eyes, but remember, Demodex mites can live anywhere there are hair follicles and oil glands, and that includes your scalp. If you have an itchy, flaky scalp that isn't responding to typical dandruff shampoo or patchy hair loss with follicle irritation, Demodex may be playing a role. So, dermatology articles have documented cases of Demodex folliculitis of the scalp, where patients had persistent scalp itching and pustules. They were successfully treated with an anti-mite medication like ivermectin cream. While the mites don't directly cause baldness, they can worsen hair shedding by triggering inflammation of the hair follicles. For example, in androgenetic alopecia, some studies suggest Demodex may exacerbate follicle inflammation. A medical study noted that a chemical produced by Demodex mites may provoke an inflammatory reaction that affects hair follicles, potentially accelerating hair thinning. So if you have hair loss plus a lot of itch or scalp irritation, this Demodex can be the aggravating factor. Healthline even lists hair loss as a risk factor for Demodex infestation. It's a bit of a feedback loop: thinning hair, scalp issues, more mites, more inflammation, possibly more hair shedding. These mites, they feed on oils and dead skins and can create an environment where the hair follicles aren't as healthy, potentially leading and hindering new hair growth. One specific sign on the scalp is similar to what happens on eyelashes. Sleeves of scale around the hair shaft, sometimes called pillar cuffing. If you part your hair and inspect areas of itch, you may find white sleeve-like scales at the base of hair strands, essentially scalp dandruff stuck around hairs. That can be from Demodex inhabiting those follicles. Another sign is follicular redness, small red dots or halos around hair follicles indicating folliculitis. Demodex can cause a follicular rash or spinulate demodicosis on the scalp, just like on the face. So we spoke to 5 signs of Demodex mite problems. That is persistent itching, especially at night, rosacea-like redness or acne, rough or dry sandpaper textured skin, eye irritation, scalp itching, or hair thinning with follicle irritation. If you recognize several of these signs yourself, you may indeed have Demodex mite overpopulation. And if you want to learn more, I invite you to visit my YouTube channel, subscribe, comment with any feedback you have. Check out my book, The Demodex Solution, as well. That's also where I dive deep into how to identify and eliminate those mites naturally. And you have the knowledge to recognize these problems and take action before even your doctor. So thank you for watching, guys. If you have any questions or want to share your experiences, please drop a comment below. Don't forget to subscribe and hit the notification bell so you won't miss our upcoming videos on skin health.